Here to discuss Ebola and the CDC, Dr. Gil Mobley, microbiologist and emergency trauma physician. Dr. Mobley Skyping in from Chicago today. Dr. Mobley, what is going on right now? What do you make of this new report from the CDC?
You know, it's not what I make of it, it's what every other emergency room physician thinks. We're at a meeting here of 8,000 emergency physicians in Chicago. We had a think tank, a booth with a think tank where they can tell us what they think about quarantine, isolating these people, the Ebola bed, thermal passports, and not one single doctor, about 2,000 came by our booth, can think of any rhyme or reason why this woman is resisting quarantine. You know, Dr. Craig Spencer, the doctor that's sick with Ebola now that rode on the subways, he was thinking the same thing. And look what awful things that he has caused at this point. You know, they're just running all around to the bowling alleys, quarantining them and everything like that. It's absolutely reprehensible. We cannot understand what she's thinking, and there's not one single doctor that came by our booth that can understand why Obama doesn't strictly follow these guys. If we're letting them in, the 150 people from West Africa, why they're not strictly following them and keeping them in quarantine. It just doesn't make sense at all to us in the trenches, sir.
So you've got that situation in terms of public health with this nurse and the doctor now obviously being treated for Ebola. The nurse, still her symptoms have not presented, and she presents a picture of defiance. I'm curious about the government's response. So many different utterances from the CDC. Are these inconsistencies or the whole notion of how this virus can be spread? Is the CDC involved in deliberate lying to the American people?
You know, either they're lying, they're incompetent, but you know what? Since day one, I said this could be incrementalism. This isn't new science that can be spread by respiratory droplets that can lay on a doorknob after you cough and touch it for days. They've known this. This is the drip, drip, drip of bad news. And the administration and James Carney and the CDC are just being derelict in their duty not to tell us the truth up front. That's what's causing any panic, is the inconsistency, sir.
I want to return to the actions of the doctor now hospitalized, being treated for Ebola in New York. Apparently, when he was questioned, when he started presenting symptoms, he told an untruth. He said he had not been out publicly. Sir, in your mind, is that grounds for a charge of malpractice?
Sir, a formal complaint has been filed in the state of New York against this doctor for unprofessional behavior. His behavior is reprehensible. The same thing in the state of Pennsylvania against Dr. Nancy Snyderman. They are being investigated right now. And the sooner these states issue sanctions against their license or reprimand or rebuke, the better we'll all be, because it'll be a message to every other healthcare worker that is as crazy as Casey Hickox, thinking that, oh, I'm not infectious.
And you mentioned Dr. Nancy Snyderman, the health correspondent for NBC News. Should she be removed from that position on NBC? And more importantly, with Tom Frieden down at the CDC, should he still stay in his job?
I'm losing more and more confidence in Dr. Frieden. The fact that the New York Post reported yesterday that you can catch it with droplets, you can catch it from a doorknob, and they said, what do you think about this? The CDC said no comment. I'm thinking this guy's getting ready to be kicked out.
What about other healthcare workers, not physicians, but a nurse, like the nurse in Maine, Casey Hickox? What should happen to her administratively as a, quote, healthcare professional, unquote?
Apparently, she's not licensed to practice nursing, at least according to the nursing board. I called yesterday because she needs a complaint filed against her license, too, for unprofessional behavior. The first line of defense should be for the American public is for the approving boards, the people that approve their licensure, to rebuke these people, issue reprimands or letter of concerns, and make it very public as a signal. You know, also the governors of these states, they need to step up to the plate, just like Bobby Jindal has, just like Chris Christie has. And any governor that does not step up to the plate and protect their people with quarantining anybody inside the state, strictly following them, making sure they have no contact, they will have blood on their hands when a cluster breaks out, sir.
15 seconds left. I want to get back to Nurse Casey Hickox. You say thus far they cannot find records that she is a, quote, registered nurse?
I called yesterday to the state, and that is the case. I don't know where she practices, but as soon as I do, she will have a formal complaint, just like Dr. Snyderman and Dr. Spencer, sir.
And Dr. Gil Mobley, we will have you back to talk about that in the not-too-distant future. America's Forum will continue here on Newsmax TV following this timeout.